guys, welcome to this episode of the Myo Minute. I'm your host, Carmen Woodland, and I'm an online myofunctional therapist and educator. I'm really happy that you're here. In this episode, I'm going to be answering a question that I get asked quite often. Why is there so much variation in the type of myofunctional therapy programs? This is a great question, and while I think the variation comes from the fact that we are all trained differently, I can only answer this question for myself. So in my practice, you do have options when it comes to myofunctional therapy. First, I will say this, I feel like you can't even consider options until you have an exam and know what your level of needs are. There are many times when I do a free 30-minute assessment with somebody and they seem really nice and easy and run-of-the-mill, but when we get to the comprehensive exam, everything is a lot different. So, when I get to the end of an exam with somebody, I take the information that I have gathered and I consider a few things. The most important thing to consider after you already know what the needs are is what are the goals for therapy. Does this person want the easy way? Do they want to do the Mac Daddy and do everything just right or just eke by? Next, I want to know about that person. What's their personality? I have them share with me. Are they accountable to be on their own? Do they need an accountability partner? Do they get overwhelmed easy? Do they have a lot on their plate in addition to myofunctional therapy? All of this information guides me as to what they should do. So when I'm working with a client, I will tell them what I think their best option is. And sometimes I will give them a second, less than perfect option, but sometimes I don't. If I know that they need a comprehensive year-long program with me and they want the cheap, easy fix, they're going to have to find someone else to take their money because I won't do it. Mostly because I like to sleep at night and I know that they're wasting their money. So that should give you some explanation about why there is so much variation. I want you to think of it this way. If you were to go out right now and go to 10 dentists and get 10 different treatment plans, what do you think the chances are that they're going to be the same? 0, right, my friend? The same with myofunctional therapy. You can't compare orangutans and oranges, okay? So I encourage you to first find the person that you know, like, and trust, and then go from there without considering what every other Tom, Dick, or Harry thinks you should do, okay? That's the most important thing. Find your person, then find what therapy they recommend, and also think about what your goals of therapy are. I hope that helps. Thank you for being here today. I will see you in a future episode of the Myo Minute.